Henry Ford Health and Mosaic Clinically Integrated Network Interim President, Dr. Courtland Keteyian. Welcome back to the show, Courtland.
Thank you. Good to be here.
Yeah, good to see you. Since you were last here, the government shut down.
Yep.
Yes. And it's still shut down. We're on, I think, day 14.
Yeah.
And in terms of health, the impacts, because we are hearing the blame game in Washington that it has to do with Obamacare, healthcare, and Medicare, Medicaid.
Yep. Yeah. Something people do ask about is it going to have impact on, on their care, because things like Medicaid and Medicare have federally administered, elements of those programs, right? So the short answer is, generally speaking, it hasn't affected anybody's coverages or anything like that yet. There may be some back-end difficulties with, like providers and hospitals getting paid for services that they provide. But by and large, it hasn't had much impact yet on people, right? As those are considered like essential services that don't get interrupted. But one of the biggest controversies that has, I think some would say, instigated this shutdown is that if we rewind all the way back to Affordable Care Act, which was like 2009, 2010, there were provisions put in there to subsidize insurance for people who have to buy their own insurance on the marketplace. So they don't get it through their employer, they buy it on their own, and the federal government implemented these subsidies. Those subsidies expire at the end of the year, and Democrats would like to see those subsidies extended because it reduces the cost of care for folks that are not getting it through their employer. Republicans don't want to see that kind of connected to the shutdown, and so we're at an impasse, and so those subsidies cost about $350 billion over 10 years. So it's a cost, right? But that has been, and I don't, I'm sure there's other things, but from a healthcare perspective, that's one of the key issues: is desire to continue to extend those subsidies versus let them expire or solve it some other way before the end of the year.
Yeah, that is the major talking point. Yeah. Republicans say that the Democrats want free health care for illegal immigrants as their talking point. And Democrats are saying, no, that's not what we're looking for, but we won't vote until that funding is reinstated.
Yeah. Yeah, which has implications for people, right? Because so the enrollment period for plans is like now, right? People start enrolling in health plans now and buying their plan for next year. So it does have implications in the short term. It's very difficult for health insurance companies to actually plan and determine what their premiums should be, what they're charging people for 2026. And so, there's definitely a potential that this affects people's ability to afford insurance next year, and then obviously if you don't have insurance, then it's harder to get certain services.
And also in the healthcare discussion is terms, and I guess with related to government funding Medicare and Medicaid in the big beautiful bill, there were some reductions in what the federal government was going to provide states in Medicaid subsidies.
Yep. Yeah, that's right. So there's I think healthcare is addressed in several ways in Big Beautiful Bill. There are provisions to increase fee schedules nominally for physicians for a couple years. There's provisions to make like telemedicine more accessible, so you can get first dollar coverage if you're on a high deductible plan, which used to be the case. In a high deductible plan, you would spend on telemedicine against your deductible. So there's some things like that, which some folks might argue is good. And then on the flip side, there's the Medicaid in particular. Two big things affect Medicaid. One is having work requirements, and this would start in 26. So states would have to have some requirements around work. I forget the actual number. I think it's like 80 hours a month or something to be able to demonstrate you're working. The other is restricting the amount of provider tax. So one of the ways that Medicaid is funded today is through taxes on providers in the state. So like facilities pay a tax on Medicare. And so that's something that definitely will affect potential people's access to those health plans. And again, then what kind of coverage? So if you've got, it's kind of two hits, right? If you've got the marketplace subsidies expiring as a result of the government shutdown happening, and then we've got Big Beautiful Bill, which definitely has implications for like the Medicaid cohort of the population. So there's a few things that could significantly impact health coverage, like as a population going into 26.
And that's 26. So
Yep.
we've got 2.5 months before anything, if
plenty of
anything
time.
happens. Yeah, plenty
Yeah.
of time
Yeah.
is it plenty should we do something now if we've got maybe something that we're going to delay until next year?
Yeah, I guess what I would suggest is for people who have, well, everyone who has coverage today may not have coverage next year, right? So especially folks that I think are in that Medicaid cohort, right? And will have a work restriction. You kind of know who you are, right? If you're not working now, but you're on Medicaid, and so your coverage next year is uncertain. Definitely would encourage those folks to get those preventive type services out of the way, right? While they have coverage. So that may be things like getting your flu shot or getting your COVID vaccine, having a mammography done or colonoscopies done, things that are just kind of standard preventive care. Good to get those done as soon as you can. And it's hard. I mean, I'll admit it's very hard to get in necessarily with like the primary care doctor before the end of the year potentially, right? Like not a lot of time left in the year. But there's a lot of services that can be obtained. Like pretty much any pharmacy will do vaccines, right? So there's a lot of things that can be provided in other environments that don't require going to your primary doctor's office to get some of those services done if you're worried about your coverage.
What about people with prescriptions, particularly ones that might have a potential to be very expensive should their health plan change? Can you front load your prescriptions as much as a year in advance?
Generally speaking, health plans won't cover multiple refills like that at once. They're usually broken out. You could fill a month at if it's expensive, you might be able to fill a month at a time, something like that. So there's usually not a good way to hoard expensive medications. But that was actually another thing, I didn't mention that, but part of Big Beautiful Bill was it's the first time there's been some provisions around restricting drug pricing. So it actually gives Medicare a little bit more ability, especially like commonly used drugs, like insulin is one people talk about a lot, to restrict on those commonly used, potentially expensive, but like generic drugs, what the limit is on pricing those. So there's some protections in there too around like drug pricing. So it's not just that, folks have healthcare coverage exposure. There's also things that will reduce cost, like the telemedicine and like the limits on cost of certain medications.
Preventive medicine, though, avoid healthcare costs of care and treatment by staying healthy to begin with.
Yeah, I mean, you're talking to a preventionist, so so yeah, I mean, that's absolutely always going to be true. I mean, I think, it's interesting. We look to the healthcare. I say we, like it's like the royal we, right? It's all of us, right? I think we look to the healthcare system to fix problems, but the fact is, people have a tremendous amount of say in how healthy they are, right? So if you look at, there's 4 major drivers of people's health outcomes: social, behavioral, and so social means do people have access to food and housing, and are they financially stable? Behavioral is decisions like choosing to drink and smoke and behaviors that put us at risk. And then environment, right? So things we're exposed to in the environment, like lead and noise and things that can affect the health. And then the last thing is clinical. And the smallest contributor to that overall pie is clinical. We as physicians and the whole healthcare a kind of economy account for probably 10% or less of overall health outcomes. 80% is driven by social and behavioral. So social is probably about 50, and behavioral is probably 30.
Wow.
And this is not just me making up numbers. This is a paper published by about 10 years ago in American Journal of Preventive Medicine. But yeah, so we actually start thinking more about in healthcare how to affect the social and behavioral drivers, and those are things that people actually have a lot of agency over controlling, right, choosing to use alcohol in excess, choosing to smoke tobacco, right, like those are things that are decisions people make that have significant influence on people's health, and reduce your need for the hospital and for doctors.
And it's so much of it's common sense. I mean, everyone knows if you eat pizza and potato chips all day long and never get off the couch, it's not going to be good for your body.
No, it's not. And actually, yeah. So it's actually kind of interesting. So so roughly 70% of adults in the U.S. are overweight or obese. It's a huge number. I think it's 40% now that are obese, which is calculated based on body mass index, and all kinds of things are associated, but bad outcomes are associated with body weight, increased risk of not just things people think about like heart disease and strokes and diabetes, but also like cancer risk goes up. And actually we've started to see that number of overweight folks decline for the first time in forever, probably. And it's probably related to the GLP-1 inhibitors, so like the Ozempic and Wegovys, and there's enough people that have gotten their hands on those and started decreasing BMI that it's actually halting that increase in percent of folks that are overweight. So it's pretty amazing, actually.
Yeah, and there's all these discussions that there will be even more access and lower costs and either easier delivery methods and
than injections. So the data we have so far suggests that the changes from taking those medications reverse as soon as you stop taking them. So it's still, which is why insurance companies generally don't pay for them for anything that's not the intended, like on-label use, which is diabetes. So folks that are looking to them for weight loss, and there are a lot, and they'll pay out of pocket. The issue has been that once you stop taking it, generally speaking, the weight comes back on. So it really does have to be a change in lifestyle to get those long-term outcomes.
All right. Always great to have you here. Thanks for all the updates.
Thank you.
From Henry Ford Health and Mosaic Clinically Integrated Network, Dr. Courtland Keteyian.